असंशयं महाबाहो मनो दुर्निग्रहं चलम् अभ्यासेन तु कौन्तेय वैराग्येन च गृह्यते. It's very difficult to control mind, but you can control your mind with abhyasa, repeated practice. Same is with ECG. You cannot learn ECG in one day. You need to practice for years. You learn about different waves, interval and segments. This is normal ECG, and in lead 1 and lead 2, QRS is positive, and in lead 3, it's biphasic or slightly positive. In AVR, it's a deep negative. AVL, it's a small positive or biphasic, and in AVF, predominantly positive. And this is normal chest leads. In V1, R valve will be smaller and S valve will be deeper, and gradually R valve will increase in size and S valve will decrease in size. In V6, you see no S valve or very small S valve. In right axis deviation, QRS is negative in lead 1, and in lead 2, 3 and AVF it's positive. Mainly right ventricular hypertrophy due to lung causes. It's usually chronic lung diseases like COPD is responsible for right axis deviation. Just opposite of right axis deviation, in left axis deviation, QRS is positive in lead 1 and it's negative in lead 2, 3 and AVF. Left ventricular hypertrophy is responsible for left axis deviation. In sinus tachycardia, heart rate is more than 100 and QRS complex is narrow. Causes of sinus tachycardia are multiple and it should be on the tip of tongue. In sinus bradycardia, heart rate is less than 60 per minute and QRS complex is narrow. Always remember causes of sinus bradycardia and it's multiple. Peaked P wave is seen in COPD and it's mainly due to pulmonary hypertension. P mitral is seen in mitral stenosis and mitral regurgitation. It's due to hypertrophy and dilatation of left atria, very big left atria. It's mainly due to anxiety and excessive tea and coffee. Wide QRS complex and T wave is opposite to R wave. It's also usually due to anxiety and excessive tea and coffee, but it may be related to heart diseases. Typical is sawtooth appearance. It's mainly due to heart valve disorders and it's relatively benign, and if you don't treat it, it will convert to atrial fibrillation, which is more serious condition. Hallmark is irregular rhythm and fibrillatory P waves. Most common causes are mitral stenosis, hyperthyroidism, and in elderly people without reason. PR interval is more than 0.2 seconds and it's benign condition. Characterized by progressive prolongation of PR interval on consecutive beats followed by a blocked P wave treated by atropine. Conduction block at atrioventricular node characterized by intermittent dropped QRS complexes. and treatment is pacemaker. Atria and ventricle beat independently and treatment is pacemaker. Most common cause is MI, myocardial infarction. Wide QRS complex, RS-R1 pattern in V1 and V2, wide colored S waves in V5 and V6, relatively benign condition. Notched or M-shaped R wave in V5, V6, and in V1, V2, deep wide S waves, just opposite of right bundle branch block. It's very serious condition and needs pacemaker. It's mainly due to primary disease of the cardiac electrical conduction system and myocardial infarction. Tall R wave in V1 and deep S waves in V5 and V6. Deep S wave in V1, V2 and tall R wave in V5, V6, and it's mainly due to left ventricular hypertrophy. Initially, tall peaked T wave is seen, then we can see ST elevation or depression, then T wave inversion, and days to weeks later, we see pathological Q waves. In STEMI, we see ST segment elevation, and in non-STEMI, we see ST segment depression. STEMI is more common, and treatment is thrombolysis. Ventricular tachycardia may be monomorphic or polymorphic. We see regular wide QRS complexes, and it's a very serious condition, needs DC shock followed by antiarrhythmic drugs. Wide QRS complex, chaotic irregular deflections of varying amplitude. It's very serious condition. Cardiac output may be nil and treatment is DC shock followed by antiarrhythmic drugs. It's usually due to MI. Low voltage QRS and electrical alternance are seen and usually due to pericardial tuberculosis. Tall T waves, decreased amplitude of P wave, wide QRS complex, sine wave, and finally cardiac arrest, asystole. Acute and chronic renal failure, metabolic acidosis, rhabdomyolysis, massive blood transfusion, and many anesthetic and medical drugs are responsible. Prominent U wave is seen. Pathognomonic is Osborn waves. Delta wave is aspecific. Sudden onset and termination of rapid atrial contractions. Rate is usually 100 to 200 beats per minute and it's a relatively common condition and it's benign condition. More commonly, it occurs in healthy individuals and it's benign and treatment is calcium channel blocker and beta blocker and permanent treatment is tract ablation which is most commonly done in cardiac centers. It's polymorphic ventricular tachycardia and it can lead to ventricular fibrillation, a more serious condition. It's related to hypokalemia, hypoglycemia, and hypocalcemia. Sinus bradycardia, sinus pause or sinus arrest, sinus exit block, tachycardia, bradycardia syndrome, atrial fibrillation with slow ventricular response. It's also called tachycardia, bradycardia syndrome. It's due to SA node fibrosis due to degenerative changes in old age. Usually pacing spikes and left bundle branch block or right bundle branch block is seen.